Today's session will focus on different types of antimicrobial stewardship data that can be tracked and best practices for reporting that data. For those of you who are new to your facility's stewardship program, you may be asking the questions, what do I actually need to be tracking to meet regulatory requirements and have an effective program? Centers of Medicare and Medicaid state operation manuals requires that antibiotic stewardship programs shall have protocols that describe how the program will be implemented and how antibiotic use will be monitored in the facility. CMS would like you to track how often and how many antibiotics are prescribed, or what we like to call antibiotic use measures. To meet current best practices and the CDC's tracking core element, you need to track at least one process measure and one outcome measure of antibiotic use. Process measures track how and why antibiotics are prescribed, and outcome measures track clinical outcomes associated with antibiotic use. In the next few slides, we'll review common antibiotic use measures and their pros and cons. One of the antibiotic use measures listed in the CMS State Ops Manual is types of antibiotics prescribed. This is the easiest measure to track. It's essentially a printout of your monthly pharmacy order. It can be useful to review for concerning or unusual drugs like fluoroquinolones or carbapenems. However, it will probably look the same most months since providers are likely treating the same types of conditions each month and using the same types of antibiotics. It can't tell you how many antibiotics have been prescribed or if that represents a change from the previous month or the previous year. This makes it my least favorite AU measure. Antibiotic starts are an easy to calculate antibiotic use measure. It's simply the number of new prescriptions per month. This is a quantitative measure, which means you can track changes over time. It can be particularly useful if you track starts by a clinical condition such as urinary tract infections or respiratory infections. Antibiotic starts is a good measure if you've implemented an intervention to reduce the number of inappropriate prescriptions. So if you've started low criteria for urinary tract infections, you would likely see a decrease in your antibiotic starts if the implementation was successful. The downside of antibiotic starts as an AU measure is that it won't capture efforts to shorten the duration of prescriptions. So it's not going to capture things like de-escalations and times outs. It's also, if you have large fluctuations in your resident population month to month, this measure won't be useful to track since the numbers were very widely. You would, in that case, want to standardize it by your number of residents each month to help it track better from month to month. Our last AU measure we'll cover is days of therapy, commonly referred to as DOTs. Days of therapy is a sum of all days for which an antimicrobial was administered to the residents. The less technical definition is we are counting up all the days that residents were on antimicrobials. There are many variations to how you can track days of therapy to tailor this measure to your stewardship program. You can track days of therapy for a select antimicrobial, by a certain clinical condition, by a unit, or by a provider. Like antibiotic starts, days of therapy is a quantitative measure of antibiotic use, so you can track changes over time and assess if your efforts to improve antibiotic use are working. Unlike antibiotic starts, days of therapy will capture your efforts to shorten durations of therapy, such as antibiotic timeouts, de-escalations, and discontinuations. The drawbacks of days of therapy is that it won't capture renal dosing, and in situations where patients are on multiple antibiotics at once, days of therapy will appear to double. The other thing is it can be a little bit more difficult to track, especially if you have to do it manually. Days of therapy is a little bit more cumbersome than antibiotic starts. Here are some examples of how days of therapy are calculated. The main important takeaway is that the number of doses given in a day does not matter. Only the number of days of therapy that were given are counted. If you are interested in tracking days of therapy, here are some tips. So if you have Point-Click Care's infection control module, it will track days of therapy for you, and you can track them at the prescriber level even. So that gives you a great antibiotic use report. If you don't have the module and you need to manually track days of therapy, you can ask for a line list and use the Minnesota's tracking tool to track days of therapy. You can also check out the Excel video that I will be sharing with y'all of a little tutorial of how you might be tracking days of therapy and presenting that data. Next, we'll cover process measures, which track how and why antibiotics are prescribed in your facility. Tracking process measures require reviewing resident medical records to determine if new antibiotic starts meet your facility's policies for clinical assessment, prescription documentation, and antibiotic selection. Process measures tell you how well staff are adhering to your stewardship program's policies and highlight areas of success or areas that need improvement. Reminder that you need to track at least one process measure to meet the tracking core element. Some examples of process measures are the percentage of antibiotic prescriptions that have dose, duration, and indication of the antimicrobial in the medical record, the percentage of urinary tract infections that met Loeb criteria before prescribing antibiotics, and the percentage of residents who received an antibiotic timeout within 2 to 3 days of initiation. And then you can also track the percentage of common conditions treated in accordance with updated clinical guidelines. And I link to the Pacific Northwest antibiotic use guidelines here, so you can check those out if you're wondering what those may be. Our last antimicrobial stewardship measure type to cover is outcome measures. Outcome measures track the adverse outcomes and costs of antibiotics. Outcome measures are mostly focused on monitoring the clinical outcome of antibiotic use. The good thing about them is you're probably already tracking an outcome measure for your infection control program. So that would be like the number of new C. diff infections and the number of new antimicrobial resistant infections in your facility. So things like carbapenem resistant Enterobacterales, ESBLs, MRSA. And a reminder that you only need to track one of these in order to meet the core element. All right, now we'll talk about some reporting. Tips for reporting antimicrobial stewardship data. The reporting core element of the antimicrobial stewardship program for nursing homes recommends that you provide regular feedback on antibiotic use and resistance to prescribing clinicians, nursing staff, and other relevant staff. When you report on antimicrobial use data and resistance to your staff, I recommend figures to tell the story of antibiotic use in your facility. So you really want to make a point with each figure you show to your facility. So it's highlighting where you need to go with your program, where problem areas are, or where success stories are. All right, so here's some few tips for effective data communication. The first one is understand your audience. Are you talking to nursing staff? Are you talking to providers? Are you talking to your medical director? You really want to narrow that in and tailor not only which figures you present and what types of figures, but what data source you're looking at. So if you're talking to your nursing staff, you probably want to look at things that nurses are going to be involved in, right? So how well are they doing with using Loeb criteria in the SBAR format? If you're talking to providers, you might want to give them feedback on their prescribing. So we're looking at the percentage compliance with Loeb criteria before prescribing antibiotics. If you're talking to your medical director, they may be more interested in the adverse impacts, right, of your outcome, adverse outcomes of antibiotic use, the number of new C. diff infections, the number of new multi-drug resistant organisms in your facility. They may also be interested in, your rates of antibiotic use over time. So just really tailoring that to your specific audience will be super helpful. And then you also want to choose the right visualization. So I listed a few different things here. And it's important to know that not all figures are created equal. So bar charts are great when you want to compare categories or trends over time. If you're going to show trends over time, like you want to show antibiotic use over time, I do recommend a line chart. That's the best way to clearly show things are going up or down. If you're looking to display proportions, you can use something like a pie chart. You just want to make sure that you don't have too many slices in there, or otherwise it gets really hard to tell what's going on. I also recommend instead of a pie chart, you can look at a stacked bar chart. So essentially, instead of looking at your whole piece of the pie, you look at a bar and it's broken down into slices that way. It's easier for people to tell how big relative slices are to each other. And then for tables, that's when you really want to highlight numerical data for comparisons. You might want to bold a specific section or just show a couple of different things with your table. If there's too much going on, no one gets that much detail out of it. And that brings me to point 3. So keep your figure simple and focused. Your figure should point out one fact. You don't want to have too much on there. Otherwise, people will get way overwhelmed and they won't see the point that you're trying to say. So one figure for each point you're trying to make in a meeting, and really just focus on that one point, maybe a second, and just have additional figures if you're trying to make multiple points during your presentation. Okay, and then here are some figures essentials. So every figure needs a clear title. If you don't have a clear title, people are very confused on what they're looking at. You also want to label your axes. So on this figure, we're looking at fluoroquinolone claims per 100,000 Medicare Part D beneficiaries. I have the year on the x-axis and the fluoroquinolones per 100,000 beneficiaries on my y-axis. I also have included a legend, which that's if you've got multiple things going on. So if you're showing 2 different antibiotics or 2 different trends, you need to include a legend and label those clearly so people can see what's going on. And then what I often see left out on figures is the interpretation or the caption. So you need to tell your audience what the data means. Interpret it for them a little bit. Highlight what you want them to see, and reiterate things like that are shown in your figure in narrative format. It makes it a lot more impactful. And then if somebody's just reading this report, they understand why you're giving it to them. And so often under forgotten, but very important. Tell me what the data means. And then I think it's my favorite tip is highlight important stuff with colors. So hopefully everybody's eyes on the screen went to this giant purple arrow at the bottom, because what I'm trying to show you here is that dentists as an antibiotic prescriber had a lot more claims than their other provider types. And so we can use color, arrows, bold, to draw attention to specific things on figures. I think it's one of those rules that sometimes should be broken, right? We want simple figures, but sometimes let's throw something on there to make it really clear what our point is. You'll also notice on this figure that I have a bunch of different colors for each of these different prescriber types. And I did that so that you're able to differentiate between one to the next. So things with like bar charts or line charts, we really need to use more than one color to show the difference. Otherwise, it's not as engaging to the audience and it could be a little bit more confusing to tell what's up. And I prefer color to things like using triangles as data points or squares as data points. I think that gets really overwhelming for a figure and hard for your audience to see. Okay, and then I linked a few different resources that I talked about here. There is the Core Elements Appendix B gets into detail about all of these different antimicrobial stewardship measures. If you're interested in checking out the Minnesota Department of Health's infection and antibiotic use tracking tool, that's linked here. And if you want a template for your antibiotic use summary reports, Nebraska ASAPS is linked here as well. All right, and this is our attendance verification for online viewers. So if you are watching this through YouTube, please scan the QR code and fill it out. That way you get credit for attending.